If you're over 70 and facing surgery, or someone you love is, this video could be one of the most important things you watch today. Hey there, and welcome to our channel. Whether you're a senior, a caregiver, or someone supporting a loved one through a medical journey, you're in the right place. Today, we're diving deep into a topic that isn't talked about enough. The 5 essential things you must know before going under the knife after age 70. Why is this so important? Because surgery after 70 is not the same as surgery at 40 or 50. The risks are different. The body heals more slowly. There's a higher chance of complications, longer hospital stays, and even long-term cognitive changes. But don't worry, being informed is the first step to reducing risks and speeding up recovery. So let's break it all down in simple, practical terms. If you're ready to take charge of your health or help a loved one make the best possible decisions, stick around until the end. And don't forget to like, subscribe, and hit that bell icon so you won't miss future updates on aging, health, and wellness. Let's get started. Chapter 1. Understand the real risks of surgery. After 70 first up, and this is critical, you need to have a clear understanding of what surgery means for someone over 70. As we age, our bodies become less resilient. Here's what that looks like. Cognitive decline. One of the biggest overlooked risks is postoperative delirium or postoperative cognitive dysfunction, POCD. After surgery, some seniors experience confusion, memory loss, or trouble thinking clearly. For some, these symptoms can last for weeks or become permanent. Slower healing in fragile tissues, skin, muscles, and even bones heal more slowly. Surgical wounds may take longer to close, increasing the risk of infection. Weaker organ reserves. The heart, kidneys, and lungs may not tolerate the stress of surgery like they once did. Anesthesia can lower blood pressure and reduce oxygen delivery, increasing the chance of complications. Longer hospital stays. Older adults are more likely to experience hospital-related complications like infections, blood clots, or pressure ulcers. Statistically speaking, according to the American College of Surgeons, adults over 70 face up to twice the complication rates compared to younger patients after major surgeries. But does this mean you should avoid surgery altogether? Absolutely not. It just means you need to go in with your eyes open and take the right steps before and after surgery to lower these risks. And that leads us to the second critical thing you need to know. Chapter 2. Get a comprehensive geriatric assessment. First, before committing to surgery, ask your healthcare provider for something called a comprehensive geriatric assessment, CGA. This is a special type of evaluation that looks at more than just your heart rate and lab results. It checks how your whole body and mind are functioning. Here's what's typically included in a CGA, mobility and balance assessment. Can you walk steadily? Are you prone to falls? This affects both surgical risks and your recovery plan. Cognitive screening. It's important to assess memory and mental clarity to gauge your risk for postoperative confusion. Cardiopulmonary function. Is your heart strong enough? How's your lung capacity? Medication review. Seniors often take multiple medications. Some may interfere with anesthesia or increase bleeding risk. Nutritional status. Are you eating well enough to heal quickly? Malnutrition is a hidden risk factor many overlook. Home support and functionality. Can you manage stairs? Do you have a caregiver or support at home post-surgery? This evaluation gives your surgeon and anesthesiologist a full picture of your health, not just your age, and can help customize a surgical and recovery plan just for you. Pro tip: if your doctor doesn't suggest a CGA, ask for one. It's often available through a geriatrician or specialized surgical clinic. Chapter 3. Prehabilitation. Start strengthening before surgery. You've probably heard of rehabilitation after surgery, but what about prehabilitation? Prehabilitation, or prehab, is about getting your body and mind stronger before surgery, so you heal faster afterward. Think of it like training before a marathon. You wouldn't run 26 miles without preparing, right? Exercise and mobility. Even light exercise 2 to 3 weeks before surgery, like walking, chair squats, or resistance bands, can improve strength and balance. reducing your fall risk afterward. Breathing exercises. Practicing deep breathing with incentive spirometers helps prevent post-surgical pneumonia, especially important if you'll be under anesthesia for a long time. Nutritional boost. If you're underweight, malnourished, or have trouble eating, consider supplements or higher. Protein meals. Proper nutrition speeds wound healing and reduces infection risks. Medication optimization. This is the time to review which meds you might need to stop before surgery, like blood thinners or certain diabetes drugs. Mental preparation. Learn what to expect during and after surgery. Being mentally prepared reduces anxiety and improves outcomes. The goal? To enter surgery in the best shape possible, physically, nutritionally, and mentally. Many hospitals now offer prehab programs for seniors. Ask your provider if one is available. Chapter 4. Plan for a smart and supported recovery. Too many people focus only on the day of surgery, but what happens after is just as important, if not more so. Here's what you need to plan before the surgery even begins. Where will you recover? Will you be going straight home? Do you need a short stay at a rehab facility or skilled nursing center? Don't wait until discharge to decide. Start planning now. Home safety. Prep. Make sure your home is recovery ready. That means clear walkways and no loose rugs. Grab bars in the bathroom. A walker or bedside commode if needed. Someone to help with meals, meds, and transportation. Schedule follow-ups early. Make appointments with your primary doctor, surgeon, and physical therapist before the surgery, so you don't miss anything important during recovery. Get help. If you live alone, line up help from family, friends, or a paid caregiver. Even a few hours a day can make a big difference. Medication management. After surgery, you'll likely have new meds, pain relievers, antibiotics, maybe blood thinners. It's easy to get overwhelmed or make mistakes. Use a pill organizer or medication app. If needed, request a visiting nurse to help. Sleep and delirium prevention. Hospitals are noisy and bright, and that can trigger delirium in older patients. Bring earplugs, a sleep mask, and a small clock to help orient yourself. Ask the staff to avoid waking you unnecessarily at night. Remember, the smoother your recovery plan, the lower your chance of readmission or long-term complications. Chapter 5. Speak up. Ask these 6 essential questions. Before saying yes to surgery, finally, before signing any paperwork or saying yes to surgery, ask your doctor these 6 critical questions. They can help you weigh the benefits, understand the risks, and make the right decision for you or your loved one. 1. What are the risks versus benefits for someone my age and condition? Make sure your doctor is comparing outcomes for people in your age group, not just younger, healthier patients. 2. Are there non-surgical options? Sometimes physical therapy, injections, or lifestyle changes can be just as effective, especially for orthopedic issues or mild blockages. 3. What kind of anesthesia will be used and what are the risks? Ask if regional anesthesia is an option. It has fewer cognitive risks than general anesthesia in some cases. 4. What's the expected recovery time? And when will I be back to normal? Set realistic expectations. Recovery may take twice as long at age 75 as it would at 50. 5. What are the most common complications, and how can we prevent them? Get specifics. Are infections common? Blood clots? Ask what you can do to reduce your personal risk. 6. How will this surgery affect my independence or quality of life long term? That's what it all comes down to. Will it make life better in 6 months or just harder? Bring a loved one to this appointment. Another set of ears can catch things you miss and help ask questions you may forget. Conclusion. Make informed, empowered decisions. Surgery after 70 is not a small decision, but with the right knowledge, the right questions, and the right plan, you can dramatically reduce your risks and recover with confidence. Let's recap the 5 key things you must know before surgery after 70. Understand the unique risks for seniors, including cognitive changes and slower healing. Get a comprehensive geriatric assessment to fully evaluate your readiness. Start prehabilitation. Get stronger before surgery for faster recovery. Plan for a safe, supported recovery at home or in rehab. Ask the right questions before saying yes to any procedure. Being over 70 doesn't mean you can't have a safe, successful surgery. It just means you need to plan smarter, not harder. If you found this helpful, please give it a thumbs up, share it with someone you care about, and drop your questions or experiences in the comments below. We read everyone. Subscribe for more videos like this, especially if you're navigating aging, caregiving, or health over 60. Thanks for watching, and take care of yourself.